if you think about today's conference, the theme of that conference is about delivering integration, delivering quality. Those are only words until people put something into them and actually change things. So the fundamental role of the workforce, whether it's the NHS workforce, local authority colleagues, people from the third sector or from the private sector, is to get behind this concept. Think about it from the perspective of the people who use our services, whether they're patients, service users or carers, and fundamentally look at those services to say, is this the best that we can do? Is this the best that we can be? And how can we make this even more expert, even better for the people who use them? I think there are a number of roles that we have. I mean, the first thing that we need to do is to make sure that that workforce is appropriately trained and capable to do the role that it does. We spent a lot of time as well exploring the values of the people who work in our public services and making sure that the services that we deliver are true and in keeping with those values. A lot of time looking at sustainability, finding sustainable solutions, making sure that as our population ages, we've got a workforce that's able to deal with the demands that are placed upon it in that respect, and then looking fundamentally at leadership and management, making sure that those resources are properly managed, that the people who work in those services are inspired and motivated to give the best that they can. Scottish Government's role is to support all of those initiatives and make sure that we've got comprehensive education programmes, leadership development programmes for people, and that we've looked essentially at how those services are delivered in the best possible way to respect and reflect the needs and wishes of our users. Patients' voice is really important in that space. Done a lot of work about developing the patient voice stuff. Staff voice is really important in that space too. If we're serious about high quality, continuity is important. We've got a hugely experienced workforce, making sure that they continue to be motivated, making sure that they continue to be energised to do these things. Fantastic. I'm really proud to lead the NHS workforce stuff. I think the people that I see doing extraordinary things every day are really, really important to us, and sometimes government's job is to just make sure that we tell them how proud that we are of them.
You talk about workforce, but in terms of integration, what does that mean for the future?
It's difficult to be precise about all of that stuff yet. We know that we've got some concepts that are at work and alive now since the Act has been made real. We know that we've got teams coming together, and the word that comes out loud and strong from all of the interventions that we've been doing with staff is that concept of teams, that perhaps something that used to look very tubular is looking a lot more multidisciplinary, a lot more multi-professional. We've been talking about that for a while, but it's real now. You can feel it now. You can go out and see examples of it. So I think there's something around that. I think there's something about people performing at the top of their licence and being respectful of the contribution of the other professions coming together in those teams. And we're seeing a lot more of that too. I had a conversation with a consultant this morning who was talking about the fundamental importance of a receptionist. I suspect we might not have had those conversations 10 or 12 years ago. It's fabulous to see us now recognising that in order to have a healthy population, having a healthy old age, and all the other services that we want to provide for children and adults and all sorts of other things, it takes a team to deliver that. I think that's the central message of integration. A bit less about have we got a group to do that, and a bit more about have we got a group of people who come together to provide health and social services across the piece.